For decades, we've known heart disease as the world's #1 killer. It's an enemy we think we understand. But what if I told you that enemy is changing? That the entire battleground is shifting right under our feet? Well, that's exactly what's happening. Let's dig in. Just look at this number for a second. 18 million. That's how many people died from cardiovascular diseases in just 1 year, back in 2019. It's a massive, almost unimaginable figure. But honestly, that number doesn't even tell the whole story. The real story is what's driving it. And that gets us to the heart of what we're talking about today, cardiometabolic diseases, or CMDs. Now, the most important word on this slide is interconnected. You see, for years, we treated things like obesity, diabetes, and heart disease like they were separate issues. We now know that's just wrong. They're all part of the same tangled web. So here's the plan. First, we'll look at the scale of this global crisis. Then we'll get into the surprising new risk factors. After that, we'll see how these diseases themselves are changing. Then we'll talk about new treatment strategies, and we'll wrap up by looking at how AI is making the future of healthcare personal. All right, first up, the global crisis. Because this isn't just some static health problem we've been dealing with for ages. It's a dynamic, worsening situation. The world's biggest killer is evolving, and we are in a race to keep up. And this slide really highlights the strange paradox we're in. On one hand, we've had these incredible successes. We are so much better at treating heart attacks, and that means more people are surviving them, which is great. But on the other hand, we're completely failing to get a handle on the root causes, the explosion in obesity and metabolic problems that are causing the heart attacks in the first place. And if you want to see just how fast this is accelerating, just look at India. The share of deaths from cardiovascular disease almost doubled in about 25 years. This isn't some slow-moving trend. It's an epidemic that's picking up speed, especially in low- and middle-income nations. So what's pouring fuel on this fire? Well, look at these stats. From 2005 to 2021, the obesity rate among adolescent boys in India shot up by a jaw-dropping 288%. This isn't an adult problem anymore. The crisis is starting younger and younger. And the results? They're devastating. 53.4%. That's the share of all cardiovascular deaths in India that happen to people under the age of 70. These aren't just numbers, they're people in the prime of their lives, and the social and economic cost is just immense. Okay, so we've got a handle on the scale of the problem, but now things get even more complicated. The risk factors we all thought we understood are being joined by new, almost invisible threats that go way beyond what you eat or how much you exercise. I mean, we all know the usual suspects, right? The things your doctor's been talking about for years. Age, family history, smoking, a bad diet, not getting enough exercise. And yeah, those are all still absolutely critical. But this is where the battlefield really shifts. We're now discovering that our modern environment is full of emerging threats. We're talking about air pollution, about the microplastics that are getting into everything, even the widespread effects of climate change. These are now being directly linked to cardiometabolic disease. And if you think that sounds like something out of a science fiction movie, check out this quote from a major medical study. Scientists literally found microscopic bits of plastic inside the plaque clogging people's arteries, and their presence was linked to a much higher risk of having a heart attack or a stroke. These invisible threats are having very, very visible consequences. So these new environmental risks aren't just raising the odds, they're actually changing the diseases themselves. The classic idea of heart disease is giving way to newer, much more complex conditions. It's really not just about the heart anymore. And here are two perfect examples. On one side, we have a new type of heart failure called HFpEF, which now accounts for more than half of all heart failure cases. On the other, a metabolic liver disease, MASLD, that affects something like 30% of the entire global population. These are the new faces of this disease. And here's the absolute key takeaway. We now know these aren't just isolated problems in one organ. They are systemic diseases. HFpEF isn't just a heart problem. It's a multi-organ disease that starts with a breakdown in the body's entire metabolic system. And that changes everything. Okay, so we've laid out a pretty big, complicated problem. The good news? Because our understanding has changed so much, we are developing a completely new arsenal to fight back. This slide shows that evolution perfectly. In the past, our drugs were targeted. Beta blockers for blood pressure, statins for cholesterol. Today, the most exciting new drugs are systemic. They treat the whole body. We're now using drugs originally for diabetes to treat heart failure and kidney disease because we realize they fix the underlying metabolic and inflammatory issues everywhere. It's like we stopped patching individual leaks and started fixing the entire plumbing system. But let's be really clear here. As exciting as these new drugs are, they aren't a magic wand. The research is overwhelming. Prevention through things like diet and exercise is still by far the most important, cost-effective, and sustainable strategy we have. Now for our last section, let's look at what's coming next. Because the future of this fight isn't just about treating the whole system, it's about treating the individual. It's getting deeply personal, and it's all being powered by AI. To see why we need AI, look at this. This shows how well a common heart failure therapy works. It's a great treatment for about 60% of people. But for the other 40%, it just doesn't work. That one-size-fits-all approach is clearly failing a huge number of patients. So what can AI do about that? Well, a study built a machine learning model to predict who would actually benefit from this therapy. The result was pretty mind-blowing. An 8-fold difference in survival. That's what they found. The AI could see patterns in the data that were invisible to human doctors, and it was able to get the right treatment to the right person. That is personalized medicine that literally saves lives. And that's really just scratching the surface. AI is popping up everywhere. It's helping doctors read scans more accurately. It's crunching massive data sets to find new disease markers. And it's even helping us discover the next generation of drugs way, way faster than ever before. Which brings us to one final big question. We've seen how our world is changing, throwing new environmental risks at us. We've seen how the diseases inside our own bodies are changing, becoming more complex. So, in the face of all that, is a future of personalized AI-driven healthcare not just a nice idea, but maybe the only way forward?